everyone, my name is Kristen and I'm a medical assistant with Dr. Huck at North Texas Diabetes and Endocrinology. This video will be a part of a series covering multiple diabetes medications. Today's video we will be reviewing Metformin, one of the most commonly used medications to treat patients with type 2 diabetes. As you can see, Metformin mainly works by reducing glucose release from the liver. It also has effects on decreasing glucose absorption from the intestines and reducing appetite. It helps your body's cells, mainly muscle cells, use glucose by reducing insulin resistance. Sometimes Metformin can help you lose weight, further improving glucose metabolism. Several hours after eating dinner, the liver starts releasing stored glucose into the blood. This ensures a steady supply of fuel for our body's cells, such as our brain or heart. In patients with diabetes, this release is exaggerated. Metformin mainly works by controlling this process, and therefore its major effect is on fasting glucose levels. Because it does not affect insulin release by itself, it does not cause low blood sugar. In addition, this can help control weight. Metformin pills come in a regular and extended release option. The Metformin HCl version comes in 500, 850, and 1,000 milligram options. The extended release comes in 500, 750, and 1,000 milligrams. Your physician will guide you on how to take Metformin. Most importantly, Metformin is started at a low dose and slowly increased over time as long as side effects do not occur. Metformin, specifically in the United States, has branded forms called Glucophage, Glucophage XR, Riomet, Riomet XR, Fortimet, and Glumetza. Metformin is also available in combination with other classes of diabetes medications, such as Janumet or Glipizide or others listed here. One clue that you are on a combination version of Metformin would be that on the bottle the dose is listed with two strengths separated by a hyphen. An example is Janumet, which can be prescribed as 50-500 milligram or 50-1000 milligram. When Metformin is first started, it is usually taken as a small dose with your largest meal, most commonly 500 milligrams after dinner. After a week, the dose is usually increased based on your physician's recommendation. This may be 2 tablets in the evening or 1 to 2 tablets twice a day. The most common effective dose is about 1,000 to 2,000 milligrams per day. Note that the maximum dose is not to exceed 2,500 milligrams in a day. There are certain situations where Metformin should not be taken. If you have persistent diarrhea or dehydration and you're unable to keep food or liquids down, Metformin should not be taken. 2 other important situations where Metformin should be withheld are number 1, surgery with general anesthesia, and number 2, CT scans with intravenous contrast. In both instances, you should not take Metformin for 48 hours after the procedure. Your doctor will order a blood test to assess your kidneys before resuming it. This is because, on rare occasions, kidney function can be compromised after major surgery or contrast administration. But of course, don't stop your medication without checking with your physician first. Metformin is an excellent choice for patients with diabetes, but it is not appropriate for some individuals. These include those with significant kidney or liver disease, or patients with severe lung disease or heart failure. You should avoid drinking alcohol excessively if you are on Metformin. Some patients may develop side effects to Metformin, usually gastrointestinal in nature. Often this improves over time, but some patients simply are unable to tolerate it. The gastrointestinal side effects are less common with the extended release Metformin. The most common symptoms that can develop include nausea, abdominal discomfort, bloating, or diarrhea. As with any medication, rare but serious side effects may occur. You may have an allergic reaction to the medicine, and on rare occasion, it may lead to a condition called lactic acidosis. Lactic acidosis is a rare but serious condition occurring in 1 per 30,000 persons. Metformin can lead to a buildup of lactic acid in the blood, causing lactic acidosis. Some symptoms of this are extreme weakness, dizziness, muscle pain, trouble breathing, or stomach discomfort. If you begin to experience any of these symptoms, contact your doctor immediately. The body eliminates metformin through the kidneys. Therefore, if the kidneys are compromised, it can build up in your system and lead to toxicity. This is why metformin should not be used in people with creatinine clearance of less than 45 mg per milliliter per minute. However, this does not mean metformin itself causes kidney problems. The body eliminates metformin through the kidneys. Therefore, if the kidneys are compromised, it can build up in your system and lead to toxicity. This is why metformin should not be used in people with creatinine clearance of less than 45 mg per milliliter per minute. However, this does not mean metformin itself causes kidney problems. Metformin can also be used for conditions other than diabetes. This includes pre-diabetes, patients with insulin resistance, overweight or obese patients, and polycystic ovarian syndrome, or PCOS. Metformin also plays a role in controlling cell growth. Some research has shown promising potential for its use in prevention of cancer, such as colon or breast cancer. In summary, metformin is the most commonly used diabetes medicine for its low cost and long-standing position as the backbone of diabetes medications. This video is for informational purposes only and is not intended to serve as a substitute for consultation or medical treatment. Please contact your healthcare provider about any questions pertaining to your specific condition. They would be able to provide you with the best answers and recommendations that are specific and accurate for you. Good luck, and thank you so much for listening.